Okay, good day and good evening and everything in between. It's a great pleasure for me to be here today, and I really want to thank you, the organizers and the chairman, Dr. CMO and Dr. McLaughlin, for inviting me to this session. I'm going to give the small company's perspective on doing a phase 2 trial, and here is the highlight of the trial. It's our candidate CS1 in PAH. We have a primary objective of safety and tolerability, but we have also other objectives which are exploratory. And we have most of the standard efficacy endpoints for this patient group. We have validated risk scores. That was mentioned by Dr. Benza, pharmacokinetics and dose finding. And we use the CardioMEMS. We will do the study in US at 6+ centers, 30 patients. We hope to enroll the first patient soon and have top-line results in Q4 next year. So what is CS1? CS1 is a reformulated VPA, a patented formulation. It's a HDAC inhibitor with epigenetic modulation. It has a 4-fold efficacy shown from animal studies, both pressure reduction in the pulmonary circulation, anti-inflammatory, antifibrotic, and antithrombotic through a fibrinolytic mechanism. When we designed the trial, we use criteria that was published a couple of years ago. We look both at safety and tolerability, PK sampling. We look at mechanistic markers. We have a homogeneous population. We have risk tools as an enrichment strategy. We use change in risk marker of efficacy, and we have also saved biomarkers for future exploratory. The study population is a well-defined PAH population with a functional class of 2 and 3 and a revealed risk score of 6 to 10. As I said, primary objective is safety and tolerability. We will implant the CardioMEMS and have a baseline period to have the patient familiarized with the equipment and also be able to have a baseline measurements. We have 3 dose groups, randomized, 10 in each. It will be 12 weeks follow-up on active therapy, and we will have, after that, a follow-up of 2 weeks. So, as I said, we measure a lot of endpoints in this. Most of them you are well familiarized with. It's both patient outcome reporting, and it's all kinds of functionality and structural changes, as well as morbidity, mortality. We use actigraphy, we use the risk scores, we use the CardioMEMS, and some of them we have a blinded reading for. So this is the setup. And as mentioned by Dr. Benza, I will not go into the risk score, but it's well validated, and it has, I think, a true value and could be a primary endpoint in the future. So we will validate that. We will also have the CardioMEMS, and I will not go into detail about the CardioMEMS since it was elegantly presented by Dr. Benza, but it will give us a huge opportunity to evaluate our therapy. As I said, in summary and conclusion, we are a small biotech. We want to have as a cost-effective study as possible, that most information for the money. We use 3 doses in 30 patients. We use the CardioMEMS and do this study in collaboration with Abbott. We use validated risk score, and we also have the measurement of movements like actigraphy. And this will be the basis for a larger study in the future, proof of concept study, placebo controlled and double blind. I'll give you 1 second back. Thank you.